Oh, you're very welcome. How are you today? Given that I already have, I probably should answer yes, and I think the real reason and issue. The Canada Health Act, if you look at it, has 5 principles: administered public, comprehensive, universal, portable, and accessible. Ultimately, if we are seeing cases of people going to a private system, that's a sign that the public system is not comprehensive, it's not portable, it's not accessible, etc. We have politicians who are not necessarily doctors making decisions about what constitutes comprehensive health care. In some cases, like myself being a transgender person, a lot of the medical procedures that have been deemed necessary by our very own doctors are not covered by the political folks, which has essentially forced me to seek private options for care. Now, secondly, should people be going to private clinics for services already offered under the public? Well, in a perfect world, there should be no market for this Corner Brook person. I don't know if they're offering faster service or better accessibility, but there's obviously, again, a gap there. And I think we as a country and as a province need to start seriously thinking about, well, what do these 5 principles mean? And if there are gaps, can we fill those gaps? Can the public system fill these gaps on their own? Or should they be looking at public-private partnerships? I mean, PPPs can scare certain people, but sometimes it's the only option. If it's either no care or a partnership, then I think you got to do what's best to make sure that the care can be provided first and foremost, and the medium or the mechanism secondary. You're welcome. It's a policy thing. Talk TV.
And Dr. John Hay. I'll just read a couple of comments from social media before we continue on the phone lines. Here's a comment from Melinda Young. Yes, I would pay to see a doctor or a nurse practitioner, and I've already done it in Alberta. I wasn't going to wait 6 months for an MRI. You could die waiting. And here's an alternative point of view. It comes in from Deborah Scatina, who says it opens up a 2-tier system. The government has to clamp down on this. So we've got diverse opinions already on the show. Let's see what Peter Whittle has to say. He's on the line from St. John's. Hello, Peter.
Hi, Dr. Hagee and Ramona.
We'll get back to Peter in a minute. They obviously, too much for them to digest, I guess, but I think I covered it. Anyways, let's hear Peter.
I think it's real hard to strike the right balance, and it's going to be difficult, but, unfortunately, we've got a 2-tier system in Canada now in different provinces in different ways, in Quebec and Ontario, as the previous caller mentioned, and there's, the availability of services and care first. But, of course, when you start putting fees in...
They're all saying the same thing, folks. You better wake up, Minister of Health. Who is it now? I think it's you, Mr. Kent, isn't it? Anyways, everyone, thanks for listening and watching.